Foya Lofa County, northwestern Liberia, a town bordering Guinea and Sierra Leone, witnessed a sick woman returning from Guinea with a hemorrhagic fever. She had attended the funeral of a family member who also died from a strange hemorrhagic fever that had a semblance of Lassa fever. She sought health care at the Foya Boma Hospital and subsequently infected 2 healthcare workers.
So when the patient came, there was not really like a lot of education like today. So they never knew. So when the patient came, they were, the way we used to give care to the patient. While giving the care to the patient, they were not properly, dressed because we never have the idea. So that how this man went to insert IV line. By inserting the IV line, we all know that the disease, this condition, the blood can clot. So while inserting the IV line, there were flashes of blood on the face.
We felt very, 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 very bad, especially the professionals. The professionals that lose and the nurse aid from the lab, from the war, I said we felt very, very bad. Up to now, as I'm speaking, it's not easy on us. We never even get people to cover the space yet.
She died and was also taken care of by her sister, who subsequently boarded a taxi and fled to Liberia's capital Monrovia and also died. Although 5 healthcare workers lost their lives to Ebola from the hospital, the death of the first 2 set an illusion of the canary in the coal mines concept.
I think the government of Liberia did not treat the health workers very fine. The government behaved like miners in the past. Miners then used the canary in a cage. When they carry it in a cage in the mine, when the radiation gets very high and the canary dies, then the mine workers take measures to protect themselves, to flee the mine. But in Liberia, it was the same. The government of Liberia did not institute any precautionary measures to protect health workers. They allowed our brothers and sisters to die in their numbers, and there were so many deaths in our country before they started to take measures to stop the Ebola outbreak.
The healthcare system should have instituted adequate measures to have prevented the already limited healthcare workers from getting infected with Ebola owing to the fact that Lassa fever had plagued the region in recent years.
So really our workers suffered, many of them died, and I will say proudly that we were proud of all our workers that died in the course of these jobs. I will continue to put the blame on the government because the government failed to actually do what they were supposed to do. In fact, I remember very well it was PSI that first raised the alarm on the issue of Ebola before other stakeholders and government officials started now looking at it.
Many skilled health workers continue to work without proper work status. Those involved play voluntary roles in the system. Skilled healthcare workforce per 10,000 people in 2015 stood at 8.6. It was 6.7 at the time Ebola outbreak started in Liberia. The first 2 healthcare workers that stood as the canaries in the mines for the Liberian health system were also victims of the improper work status. Their families did not receive death benefits from the government, but the Health Workers Association of Liberia, NAWAL, organized a memorial service and raised funds for the families of the dead. The fundraise was meager and it could not cover the family's financial vacuum left back by the fallen heroes to Ebola.
We really think for the first help that come, but still, yes, we are still need help because the children are plenty in our hand. We are struggling. They really hard on us because send that time they send our help. It is not easy. Sometimes we have to go in with call contract just for us to eat or send the children to school.
The health workers' unions intensified their advocacy for better wages and incentives as they were among the underpaid sectors in the country. They had staged a nationwide strike action before the Ebola outbreak, which led to the dismissal of 2 of their leaders, Joseph Tamba, President, and George Paul Williams, Secretary General. International labor rights groups have led campaigns for the reinstatement of the leaders of the union, as their dismissal is illegal and falls contrary to the Liberia's constitution and labor laws. The labor rights group Public Services International (PSR) for short, and the United States' largest healthcare workers union known as SEIU, United Healthcare Workers East. But the government remains vindictive.
For the past 8 years, we've been trying to bring the unions and the government to a table where we can have discussion for workers to be recognized. The government has not been positive. They have been very negative. They have always been very aggressive to our union members. Members have been dismissed from their jobs. Attempts were made for them to be recalled, and the government is not even willing to do that.
No, let's be very, very clear. The two persons you're talking about were the two leaders of the so-called Health Association, an institution that has never been sanctioned.
The president is in the error because Health Workers Association, in fact the Health Workers Union, has gone through all the requirements put into place by our laws, and we have been registered duly as a trade union institution, and we have been paying our taxes to the government. So we don't understand how come she is saying we are not recognized when for so many years this institution has been into existence.
Other countries like Ghana and Nigeria, where unions are seen as major stakeholders and they are given their own rights, and they also support and assist the government in actually discharging some of these responsibilities. For Liberia, I can tell you, we are having very big challenges, and the only way out is for us as global union federations to come together and with the ILO and other stakeholders outside the country to mount real pressure on the government so that at least they can do what they are supposed to do. Because outside Liberia, the government is seen as doing very good jobs, but unfortunately, if you go to Liberia, you find that the story is completely different.
I feel very bad as an individual seeing health workers scratching for salary. But there's nothing you can do because they have to do that to get their salary, what they work for. Even though they took off to serve their country, but that's why they have to get a pay to sponsor to their family.
My position and that of the Ministry of Health is very clear. Nobody says they're not entitled to have a job. They are professional health workers, they're entitled to have a job and work, and nobody will stop them, not even in the public health system. But to go back to those positions of the, what they call themselves, Health Workers Association, and head it, when they led a strike that led to people dying, they cannot go back in those positions. But they can get a job anytime in the health system, and we told them that.
First and foremost, if the president is serious about what she said, then why did she dismiss us? She is saying we are free to work in the public sector, but we were working in the public sector and she dismissed us. So you can see that it's the lip service. The president is not being honest with the people. Okay? Secondly, she is not the one to determine who leads the workers. That is interfering with the workers' affairs. The workers have decided and they have chosen us to be their leaders.
Her promise seems sugarcoating as the two are healthcare workers and have no other career. She did not even recognize Nawal and cannot give them union status. But the underlying issue is, why did the healthcare workers strike? Certainly, it was for government to mend the weak healthcare system that the Ebola outbreak exposed. This is inside the JFK Hospital Ebola Treatment Unit, ETU for short, through the eyes of an Ebola fighter.
We started with nothing. The PPE were not having it. We only used to wear our long sleeve, our sock, and our uniform. Usually was what we used to do. So it was not easy for us here.
The other healthcare workers at the same hospital staged a go-slow again for the lack of protective equipment, as they were the first point of contact.
I'm saying that before we can return to work, we need our month of August salary, we need our proper equipment to use to work with, and we need insurance benefit, we need extra per diem to motivate us. Because our life at risk, we are at the front page. Coming here today is not anything because we choose the profession, as I said. But equally so, if anything happens to us tomorrow, let us be at the stage that our family tomorrow will not cry alone or cry free.
Collecting the blood samples from the patients posed risks to the healthcare workers getting infected. They fought to save lives with their bare hands in many places. There was no protective equipment to ensure that they are not infected. The healthcare workers continue to be underpaid and most lack adequate labor insurance. Some kept away for their personal safety.
The rate at which it's spreading is overwhelming the existing system to contain Ebola. Because the moment health workers started dying, the rest of the health workers kept away from the hospitals. And yet when you fall sick, you should go to hospital and get a health worker to treat you. So when the hospital shut down, where would the patients go?
The number of patients per bed was outnumbered, thus creating stress for the doctors and nurses working in the ETU.
Well, there are very few Ebola treatment units. As we speak now, we only have, I think, 4. Very limited space. JFK takes 35 beds. That's the bed capacity, but they go up to 70 patients, and then that's the limit. They have nowhere to put the patients.
Following several cries, the international community came in with help, but the worst has been done. There are no ways to undo the deaths of fallen physicians in the fight. Those that got infected narrated gruesome ordeals experiencing the deadly virus.
Well, my situation first, when I contacted the virus, I was very, very bad. Very, very bad. But I thank God first, because God comes first in everything.
So when you are in that center as a patient, all you feel is, you could die anytime.
Different curative methods were utilized by the healthcare professionals in the fray. A specialized medical unit was built. This reduced the number of healthcare workers dying, but it did not stop the marginalization and abuse of their rights.
Our global partner, Public Service International, organized a delegation to attend a UN Ebola Recovery Conference. We took that opportunity to organize a conference called Honoring the Fallen to welcome those who cared for their patients during the epidemic. It was also an educational opportunity for U.S. healthcare workers and employers. Our union immediately partnered with our hospital leaders in New York and in California to provide training for 5,000 frontline healthcare workers on health and safety protocols in caring for Ebola patients. Some of our hospitals became Ebola-designated facilities. It was important for our members to know that 400 healthcare workers in Liberia, Sierra Leone, and Guinea died of Ebola while taking care of their patients and communities. We remain committed to ensuring that our sisters and brothers in West Africa have access to the same kind of resources and training to take care of their patients and to ensure their own safety while doing it.
Named and styled Investment Plan for Building a Resilient Health System in Liberia 2015 to 2021 is the Bible for the new kind of healthcare system policy document that should be caring for the health of the nation that was recently highly plagued by the Ebola virus disease, the EVD outbreak. According to the plan, its goal is to build a resilient health system which restores the gains lost due to the EVD crisis and provides health security for the people of Liberia by reducing risks due to epidemics and other health threats, and accelerates progress towards universal health coverage by improving access to safe and quality health services. It also aims to ensure for Liberia access to safe and quality health services, a robust health emergency risk management system, and an enabling environment that restores trust in the government's ability to provide services. The drivers of such plan are the healthcare workers. It is enshrined in the document as a first of high priority investment area. The document emphasizes a productive and motivated workforce. Training of healthcare workers have got underway to satisfy the productive segment of the document, but the motivating factor still remains a mystery. There are lots of discrepancies with the payment of wages and incentives of healthcare workers, in addition to the problem of no work status of healthcare workers serving voluntarily for years in the system. Healthcare workers are so afraid to speak out for fear of being dismissed and suppressed, as is being done to the two leaders of the National Health Workers Association of Liberia, NAWA. We had to conceal the identity of this healthcare worker so as to avoid repression by the government.
Now some people are not on payroll. Even some people were employed up to now, they are not getting their incentive, which is allocated for health workers that are working in rural area.
Many other healthcare workers complain that their salaries are usually cut unlawfully. Additionally, the document does not address the long-distance healthcare workers have to travel to access banks to get paid in rural communities. This makes the facilities to have less number of healthcare workers to provide care to the people.
The resilient health plan theoretically is a very good thing, and we all feel if it is implemented to the letter, it will yield good results. Unfortunately, what is unveiling does not seem to prove that we're going to yield that desired results. Because you see, when you talk about resilient health sector, the foundation of the resilient health sector is a resilient workforce, resilient health workforce. And so there must be training, which we see, is going on, that is good. There has to be infrastructure, which we are not seeing to the level it should be. And the welfare of the health worker must be looked into, which is highly discouraging in the country.
The government did not involve the healthcare workers' unions, both public and private, as in the crafting document, as they have not recognized the public union. The plan projects the increase of the number of healthcare workers per 10,000 people from 8.6 in 2015 to 11 in 2017, and reaching the ultimate goal of 14 in 2021. Healthcare workers doubt the achievability of such with the current trend of demotivation they are experiencing. There are many accounts of officials of government seeking health care in other countries, thus contrasting the commitment to building a resilient health care system to cater to the health needs of the Liberian people.